Greetings and welcome to Ramblings. I'm Kirk Wilson, former mayor of Carlisle, and I had an elected official that told me that when I was trying to make my point, I rambled too much. So that's how we came up with the name Ramblings. And over the past number of months, we've had some really interesting and I would say interesting interviews. I've had interesting guests. I've done some alone and stated my opinions. But today I think we'll have our most interesting guest ever. I'm going to let her introduce herself, and then I will start with the questioning. So, Lauren, please introduce yourself.
All right, thank you. I'm Lauren. I'm Lauren Nelson. I'm a therapy awareness advisor for spinal cord stimulation. I am not a medical professional. I am a spinal cord stimulator expert, and a big part of my job is educating the community on a type of treatment option for chronic pain, and spinal cord stimulation is a great treatment option for pain.
Well, I guess they call it being transparent, that we should let everyone know that I did have. I went through every step process, and it's I have it in my body right now. I'm a believer in it, and I thought that when I had first heard about it, I was surprised. I didn't know anything about it. So just tell me a little bit, what's the background, how does it simply work that the viewers would understand?
So the basic part of spinal cord stimulation is it's similar to when you were a kid, you bumped your head and your mom rubbed your head for you. And for some reason, it always made it feel better. Spinal cord stimulation is based off of the same theory that we, distract the brain by making another sensation. So when your mom rubbed your head, it felt good. So then the brain didn't pay attention to the pain signals as often. So with spinal cord stimulation, we're sending electrical signals or white noise up to the brain. So the brain's paying attention to that versus the pain in your legs or back or wherever your pain may be.
That's interesting that it hasn't affected my brain in any other way.
Correct.
So how would someone, let's just say, I stumbled upon it. I contacted the company you work for. Mm-hmm. I was close to having surgery at that point. They said, well, let's wait a year. So I think I'd completely forgotten the initial contact. Yeah. So they got back to me, and we were talking, and I said, I explained the surgery was somewhat helpful, but I still had pain I really was not happy with. And so how does someone say, do you discuss it first with your doctor? Do you call a provider such as yourself? How would if someone was suffering back and knee and all, leg pains, how would they decide, how would they start the process of determining if this is right for them?
Yeah, so pain management physicians are the providers who actually do the procedure that begins the process.
Right, okay.
So typically you are either referred to a pain management provider by a surgeon in your case or a primary care provider. We also see people coming into pain providers via podiatrists, chiropractors. However, everybody's journey is a little bit different, but the initial step is to get to an interventional pain specialist. And those are pain providers who do injections, epidural steroid injections, trigger point injections, and they have a treatment options for your chronic pain.
Okay, because I was scheduled for a spinal injection, and when the surgeon said to me, the physician's assistant came in, you ready? I said, nope. What? I said, I don't want a spinal injection. I want to talk about this electronic stimulation. Mm-hmm. And he was very helpful. Talked to both the pain management physician as well as my surgeon. Mm-hmm. And so that was how the process got started for me. Now, so let's get to the point where we assume that the surgeon and the pain management physician concur. We think this might be a good fit. What's the first thing that happens?
So first thing that happens is you have to be referred to a psychologist or psychiatrist for it's called a neuropsychological evaluation. They do not assume that you're crazy. They want to make sure that you are of sound mind to know that something's going to be implanted in you and you're going to have control over it. Another big thing they look for is uncontrolled depression. Pain and depression go hand in hand, and depression's okay. They just want to make sure it's being treated or is controlled. Those are the main things that they look for. And the main reason you have to do this is because insurance requires it.
Right. I found it interesting. I had a great time during mine.
Yeah.
Everybody swore up and down that they were going to probably have to end up, incarcerating me after the psychiatrist was done with me. But it was a little intimidating.
Yeah.
I mean, it could have made me not go through with it, except the pain had reached the point that I'm ready for anything.
Yeah.
Okay, so now you got the clearance from the psychiatrist or psychologist. Next step.
So then it's submitted for authorization through your insurance, and almost all insurances cover this. We'll talk about the trial in a minute, which sometimes people think, oh, this is more of a trial, like they're trying, like a research trial, but it's not. It's covered under insurances. Medicare covers it, and that the pain provider will work on getting the insurance authorization for the trial, which is then the first procedure that you get.
So are we at that point? Or
We are.
Okay, tell me about the trial.
So the trial is, and this is the most unique thing about the spinal cord stimulator, is it is the only back surgery where you get to try it first.
True.
Other surgeries that you had in the past, the surgeon didn't say, oh, let's try it out to see if the fusion or laminectomy works for your back. You have to get it, and there's a good chance that it could work, but there's a chance that it might fail. With the spinal cord stimulator implant, you get a trial first. It's done percutaneously, which means a needle, so there's no incision, and the pain physician can do it either in their office or at a surgery center.
Okay.
And what they do is similar to the epidural steroid injections. You're on your belly in the procedure room, and they give you numbing medication. Sometimes they'll give you a little anesthesia. Every physician's different. I don't believe you had any numbing or anesthesia for yours.
So,
no, they just give you local
I think they forgot
numbing.
the numbing too, but that's okay.
Right? We'll have to talk to your doctor. And then what they do is with a needle, they insert a catheter wire. And right here is the catheter wire that they insert. It looks like a spaghetti noodle. Mm-hmm. Okay. That goes up into an area, usually for like low back and leg pain. We have an idea of where it should go. T8, 9, 10, which for ladies is about the bra strap area. And some people get confused and say, well, why are you putting it up there? My pain is lower than that. Well, we are going above the pain area at the nerve root to stop the pain from going to the brain. So once the wire is inserted, that's where you come into play, myself and the physician. I turn on the machine and I would say, hi, Kirk, it's Lauren. I'm going to turn the stimulator on and tell me where you feel the tingling. And you'll feel a nice tingling sensation, and we want you to feel that where you have pain. And then once you agree, myself and the physician all agree that the tingling is in the right spot, then they'll tape everything down on your back, and there's a lot of tape on your back, and we will fine-tune the programming in the recovery area.
I remember that.
Yes.
And then, so I got something temporary in me. So what's that do?
So then you get to go home with it. Okay. So this is the external trial battery that you'd wear, and you did wear, and a Velcro belt for the week. Because the trial is temporary, this is not implanted in you. This is bigger than anything that would be implanted. So this is around your waistband. We program this in the recovery area. So we give you different types of tingling sensations. We give you some programs that are so fast you can't even feel them. Sometimes we can combine them together. Sometimes they're separate. And then you get to control those all with this remote control. This is similar to your TV remote. You turn the volume up, you turn it down, or you can change the program or essentially change the channel.
Okay.
And then during that week, you get to see, we're not looking to eliminate 100% of your pain. We're looking for a 50% reduction in pain or more, and really overall bigger quality of life, increased quality of life. Can you stand longer, walk longer, go to the grocery store without doubling down in pain, sit through a dinner at a restaurant without feeling like you have to get up to move around. Things like that.
Sure.
We want you, whatever your goal is, everybody's different. We want to see how it increases your quality of life.
Well, I can tell you during that brief trial period, I noticed a significant difference. And so because of that, I went back and I met with all parties concerned, and the next step was?
Yeah. Oh, before that, everything's removed, too.
Yeah, oh, that's right, yes.
So all the tape comes off your back. The trial is about 5 to 7 days. Some physicians say 3 days is enough time, but 7's usually the max because you cannot shower.
Right.
You have to be careful with your BLTs. Remember those? The bending, lifting, and twisting. Yes, you got it. Because the trial wire is in there temporarily. So if you bend too much, the wire could move. Right. It wouldn't hurt you, but what if your pain was on the right side and now all the stimulation, the tingling's on the left?
Right.
It just doesn't tell us if it helped or not. So that's why you have to be careful with those things. And then no showering because you can't get the leads wet on the back of you.
Sure.
And then if that works, then you get referred on to a surgeon. So the surgeons that do this are neurosurgeons and orthopedic spine surgeons.
Okay.
Some pain management doctors do their own implants, but in this area, you're typically referred to a surgeon.
Okay.
And not all back surgeons do these implants. So you'd be referred to one that does do the implant.
Correct.
You have a consultation with that physician and determine, yes, I had 50% or more pain relief during the trial. And the surgeon wants to hear from you. Yes, this worked for me. I'm not telling you that it worked for you. Your pain physician's not telling you it worked for you. The surgeon's certainly not telling you it worked for you. They want you to go in and say, yes, this thing was amazing. I was able to do X, Y, and Z better than I have before. Or sleeping, that's a big thing too. I was able to sleep better than I was before. And then if that's all good, then you get signed up for surgery for the permanent implant.
Okay, and from there, it's the procedure is really outpatient.
Yes.
Yeah, that's come to think of it. I was in and out the same day. And so then I get a whole bunch of toys after that.
Yes,
okay.
yes. So one, you get no tape on your back, so that's a good part. A surgeon will either put to implant the same type of wire that you had for your trial, the skinny catheter wire, or they will implant this paddle, we call it. So this paddle is too wide to go in through a needle, which is the main reason why a surgeon has to implant this.
I think I have the paddle.
You do have a paddle, yep. So the paddle is placed in the same place that the wire was for your trial, because the trial told us this worked for you. So we're putting this up in the same area, and by we I mean the surgeon. It is then connected down to a battery, which looks like this.
Okay.
So much smaller. It's about the size of an Oreo cookie.
Okay.
Also is the same size as a pacemaker.
Oh.
And all of this is under the skin. So this is up under the bra line again for ladies who wear bras. These tails are all tunneled underneath the skin superficially. And then that battery pack is placed either on the left or right side, either above or below your waist.
Okay.
So kind of the love handle area is what I like to say, where we all have a little extra.
Right.
Extra to
cover it up.
Yes,
Okay.
yes.
All right.
And you're under general anesthesia for this one. So you're asleep, typically in and out the same day. Once in a while, they'll keep you overnight for observational hold, they call it.
Okay. All right. Well, now we're in and we're working. So let's say I'm not happy that it's not working right. There's something wrong.
Yeah.
What do I do? I mean, I can't ask them to take it out. I don't like it.
No. So that's when you call us.
Okay.
You call your spinal cord stimulator rep. We've become friends already through this process because we were in the process during the trial and during your consultation, during your surgery.
Yeah, you guys were fantastic.
Thank you. We go to your follow-up appointments, and then after that, you have our cell phone numbers, and you call us and you say, hey, as you heal, as your activity increases, you might have a pain that comes on. Hey, do you mind if we meet at the physician's office for a reprogramming or an adjustment, we call it. So that's where we'll get our computer out and we're able to fine tune the stimulation to better, cover your pain areas. If, maybe one area, that was working for a while, but now scar tissue grows, we can program around that scar tissue to give you better coverage and pain relief.
Which you have done, exactly.
Well, thank you.
So now this thing is in me. There's a battery in me, right? I don't get to see either one. So what do I plug myself into to get the battery charged?
Yeah, so you're kind of a bionic man now, right?
I think so.
So the nice thing is it's all wireless.
It is.
You do not have to plug into anything. There is a charger, which is right here. It looks like the hockey puck. This actually finds your battery. So anything that's metal, here. It stops beeping.
I see. Okay.
So what you'll do is you'll turn this on. You find your battery, kind of like a stud finder, in your back. It will stop beeping. And then you can either use a belt or double-sided medical adhesive pads to hold the hockey puck on your battery. And it charges wirelessly right through the skin.
I think of everything. That's the one thing that really just I haven't comprehended yet. I mean, you're charging a battery that's inside of you by placing the charger outside of you, and it's like, and you don't feel it. You don't feel a thing when it's doing it. In fact, when I've had it, there have been times that I've forgotten it was on my back.
Yeah.
And it wasn't until perhaps I went to sit down and I said, oh, that's there.
Yeah.
So.
And it takes about an hour to an hour and a half to charge. after that time, it does shut off, but you can forget about it and just have it. It's not overcharging you at that time.
And you're talking about charging. You're not talking about a fee. You're talking about
Correct. Yeah. And how often do you charge?
about every third week.
Okay.
Yeah. I was so surprised. That, my cell phone doesn't last nearly that long.
No.
But yeah, it's almost still a unique thing for me to be able, to be charged because it goes 3-4 weeks sometimes.
Yeah, that's amazing.
Yeah. So.
And energy, the charging depends upon energy usage. So there are some people that do have to charge once a week, twice a week.
Okay.
And then others like yourself up to like 3 times or every 3 weeks.
Right.
Yeah.
I think I went 4 weeks only because I forgot about it.
Okay.
And then I looked and you go.
And
it shows you
yelled at you.
It shows you on your TV remote there that your battery is low.
Yes.
So.
Yep. And they probably yelled at you and said, "Charge simulator battery now."
I think I actually had to call you to say, "What does this mean?"
Yeah.
So then after that, it's there. It's worked well. Is there anything else that you would like to talk about? Things that I haven't brought up.
Restrictions. So people ask about risks and restrictions, things like that. So risks of the trial procedure are the same as a risk to an epidural steroid injection. And your physician will go over those with you, but the risks are very low. For the permanent implant, the main risk is risk of infection, which is the same risk as any knee replacement, any
hip replacement.
Yes, anything that's going to be implanted in you. And your surgeon goes over those risks with you also. And then activity, the idea is that hopefully you're doing more activity after the implant than before. So you have a short time after surgery where you are restricted with the BLTs once again, because we want the paddle lead to be, it's anchored down, but we want scar tissue to grow to really keep that in place. Yep. Okay. But then after that, after you heal from surgery, you're able to do hopefully even more activity than you were before.
I didn't try out for the semi-pro football team this year.
Yeah, maybe next year. It's a good year to take off.
Yeah, I think so. Okay.
Yeah. And then, yes, so another question that we get asked from patients is, what if in the future you do injure yourself? Does a stimulator block that pain from coming through where you won't know that you're injured? And the answer is no.
Correct.
It's there for your chronic nerve pain. If your pain is more right-sided and then it moves towards the left, we can absolutely try to adjust it or do a reprogramming to get more coverage on the opposite side. And then if you do need back surgery for a future, injury or something that your surgeon says, yes, you need to have surgery for this, you just turn off the stimulator and they can still do your back surgery and keep the stimulator in.
Okay, great.
Yeah.
Well, it'd be interesting that... I feel I never quite felt like a guinea pig, but because as I would say, while the doctors and the surgeons and the nurses and everything were important, I think what ends up being most important is your rep, because having someone go through the whole process with you, I don't know that there's any other surgeries where you have someone that's as knowledgeable, for instance, as you and your colleagues are. But they're, like you said, you're with us from day one through, and we see you afterwards, and that doesn't happen. And so I think it was very positive. So
thank you.
I would like to thank you for stopping in today.
Of course.
And we will identify at the end of the program how people, if they would like some additional information, how they can get through with that.
Okay.
So, Lauren Nelson, thank you so much for being here.
Thank you for having me.
I would like to thank you all for viewing. And my name is Kirk Wilson, former mayor of Carlisle. You're watching Ramblings, and you just never know what we might have up next. So check us every week. Thank you.